Okay, welcome everybody. I'm really excited to have all of you here and thank you for attending, and I hope this presentation provides a little bit more details and provides some more information about this COVID-19 funding opportunity. I do also want to mention that this is being recorded, and the presentation, the slides, and this video will be sent to you after this meeting. So can be used for reference and for folks who were not able to attend who may be interested in the information that we are presenting today. Let's see here. Okay, I am actually going to circle back once a member of our team joins, where he will present our mission and go through a few things here. I did also want to mention a few housekeeping rules. I think we're pretty well versed in this virtual world, but please remember to mute yourself when not speaking. If you have any questions, please raise your hands or put them in the chat. I have a lovely team here that will make sure to get my attention to stop presenting for questions, and we'll be able to answer some questions through the chat. So as I mentioned before, this presentation is to provide information to our wonderful individuals and organizations here, and going to do a brief overview of the program, provide some important dates, nitty-gritty fun stuff, and then I'll also introduce our cohort team leads, which you have probably already received some emails from, and then I'll also go over next steps. So the purpose of this program is to conduct culturally relevant education outreach activities and disseminate COVID-19 information to communities to support disproportionately impacted by COVID-19. I think we all, work to be able to provide and fill gaps and provide accurate information to our community members. And, really at the end of the day, we want to create and live in a healthy and safe community. And I want to thank each and every one of you for helping make that possible in our region of California. So thank you, and I deeply appreciate everything that you all do. So you may have seen this in the notification email that went out, and I wanted to provide a little bit more information about this. So this represents the funding level and the expectations of engagements or meaningful interactions with community members. So if, for example, if your agency was awarded $5,000 or less for this grant, the expectation would be to interact with or have about 100 engagements. This is retroactive, so this goes from November 1st through March 31st. So November 1st, 2021 through March 31st, 2022. So let's see here. So these are approximate numbers that we definitely want to see, and some of you may have already reached your goal and gone beyond that, and that is amazing, and I really appreciate all that hard work, and we do too, but we would also encourage to continue the hard work through March 31st with this funding. I believe our team member has joined us, so I am going to go back a few slides and turn it over to Larry. Let's see here. Get that going. All right. I'd like to introduce Larry Olmsted. He is our president and CEO, and he would like to say a couple of words.
Yeah, thank you, Carrie. Can everybody hear me? Can you hear me okay? Great. So I'm looking at those of you who have joined us, and I see many familiar and friendly faces, and see some new friends for me. And I think one of the things that's characteristic of this project and this particular part of the project is around trust. We have learned that there are partners working in our communities doing awesome work, and that we know that we just love to work with you. And we know that the dollars that are being disseminated are going to be used well. And we are in this position because our funders know that we care, that we care about money being used well, that we care about our communities and the people in them. I wanted to focus very quickly to remind folks about United Way's mission, and because it's really sets the context for why we're involved with this work. Particularly caring about the health of every person in our community. And one of the reasons we're involved with this particular aspect of the project is because all of you who are working for nonprofits doing incredible work on the ground, all of you are able to help us reach all of the different segments of our community. Okay, we care about equity. We care about just especially that programs like this, when we know COVID, for instance, has disproportionately impacted a variety of demographic segments, we care about that. And we know that working with this group, continuing to work with this group will help us address that and help the communities address that. So I just wanted to salute you for doing the work that you do on the ground. I wanted to emphasize that for us, your ability to help us reach all segments of our community is front and center of why we are wanting to work with you. And I wanted to also emphasize that we know and trust the kind of efforts that you all put in to help our community and all the people in it. So that's all I wanted to say today. We have an amazing team here at United Way that is going to be working with you to quickly deliver, just more outreach to our community. And I just have total full confidence in that team that they're going to work effectively with you to address all this. Please know that all of us, including me, are available to you with any questions, comments, or concerns. Do not hesitate to reach out to me or any other member of our team with any of those. So with that, Carrie, I'll kick it back to you.
Thank you, Larry, so much. All right, let's get moving to where we were. All righty. As I was saying, these are the kind of rungs that, based off the funding that you receive, the expectations of engagements. Again, it doesn't say on the slide, but if you receive $5,000 or less, we're expecting about 100 engagements between November 1st and March 31st of this year. So please, if you have any questions or concerns, please reach out to your cohort lead, which I will also be introducing here in a few slides. But you have probably already received an email or two from them. So I will continue moving. Let's see, I think that's back. Okay, fun technology stuff. Okay, looks like I'm in a loop. All right, there we go. So allowable costs for this funding can include, staffing for outreach, printing, mileage for the outreach travel, other operational expenses tied to the performance of eligible work. And I do also want to mention that purchasing incentives for vaccinations are not allowed with this funding, but providing information, providing information on topics, which I'll go over in just a minute, are definitely allowable. We want to be able to provide accurate and trusted information to our community about COVID-19 safety and vaccinations. So some of the topics that could be included, and these are not limited to, but basic COVID-19 safety, whether that's social distancing or physical distancing, masking, the importance of wearing masks, and the different types of masks and efficacy surrounding that, hand washing, vaccination information and availability in your community, what's happening locally, testing information and availability as well, quarantine and isolation requirements. I know that the CDC and the state and the counties have likely just adjusted to some of the quarantine and isolation guidelines. So being able to provide that information may be helpful for individuals. And then also community resources needed to recover from COVID-19 for those who have been greatly impacted, which I know is a very large amount of our community members. Again, these topics can include, but not limited to. And I know that there are organizations out there already doing this amazing work. So thank you so much for that. Moving on. So for important dates, just a reminder that the grant performance period is from November 1st, 2021 to March 31st, 2022. So I did mention that previously with the number of engagements. If this is work that you've been doing, you likely have made some headway between November 1st and now with your number of engagements. And we definitely, want to include that. So, and then this funding is set to end March 31st of this year. Another important date is please have the signed MOU and copy of your agency's W-9 sent to your cohort lead, and that is due February 11th by 5:00 p.m. Some other important dates regarding reporting. There will be 2 financial reviews, reports, excuse me, not reviews. Financial report number 1 will cover November 1st through November 1st, 2021 to January 31st, 2022. And this will be due February 28th by 5:00 p.m. And I should have mentioned earlier, but the financial report template and the MOUs will be sent out a little bit later this week. Financial report number 2, which will cover February 1st, 2022 to March 31st, 2022, will be due by April 5th by 5:00 p.m. There are weekly outreach reports, and we'll go into detail on how to report with your cohort lead. Some of you may have already seen a calendar invite or a doodle poll type of question from your cohort leads to schedule that. So that meeting will be important to answer any questions that arise either from this meeting or just in the day-to-day. And so they'll be there to answer questions. And they'll also review how to report the outreach data. And next, I would like to introduce our United Way of Northern California team. These are your cohort leads. Like I said, you've probably already received an email or 2 from these folks. So we've got myself. I'm Carrie Tours. I'm a senior program specialist. We have Miriam, Teresa, and Misha. And as I go through these slides, I will let them introduce themselves to you. Okay, so first up is myself. I have my contact information listed here. Please feel free to email me or text me or give me a call. And the best number to reach me is on this presentation here. And over on the side here, we've got our the cohort that I will be your leader for. So if you are listed here on this slide and you have any questions, please feel free to reach out to me. I'm more than happy to answer any questions or have any conversations or regarding concerns or anything, or if you just need to bounce some ideas off of someone, I'm definitely here for that as well. So I look forward to working with you all, and excited for our cohort meeting happening later this week that I will send a calendar invite out soon. Okay. And next up we have Miriam. Miriam, are you here?
Yes, I'm here. And I am Miriam Kalmogo, and I will be your cohort lead. So if you see your name on the right, so I will be the one calling or emailing you. So if you pick up the phone and you hear someone with a strong accent, it's not a marketer. Just answer. It happens. So so if you are here, you already got an email from me. If you haven't, you are welcome to text me, call or text. That's good. If that's easier for you, you can email me too. And I would follow up this meeting also with a calendar invite and information, the presentation. Okay.
Thank you. All right, let's see if I can advance the slide here. All right, Teresa, are you here?
Yeah, I'm here. Hi, y'all. My name is Teresa Jolch. I'm a project coordinator here at United Way of Northern California. And again, such a pleasure to serve you as your cohort contact. If you see your name listed here, your organization, then we'll be working together. And again, as everyone else mentioned, I too am open to whatever questions or concerns you may have. We'll walk together to learn a little bit more about the financial reporting as well as the weekly reporting as well. Hopefully we'll make it easy for you to access. And again, if you have any questions, I'm here for you. I'm also going to drop my information into the chats. And hopefully you have already received at least 1 or 2 emails from me. And if not, please reach out to me so that we can connect. All right. And yeah, looking forward to it.
Thank you, Teresa. All righty. Okay, and last but certainly not least is Misha Pixton. Misha, are you on here?
Yes, I am. So hi, everybody. I'm Misha. As you can see, if you are on my list, I have already hopefully gotten in contact with you. A lot of you have responded, which is so lovely to see. Please feel free to reach out if you have any questions. I will do my best to answer them, and I will do my best to figure it out if I don't know the answer. So thank you so much.
All right, thank you so much, Misha. Okay, so another thing that your cohort lead is going to share with you are some links to a Google Drive. In this drive, we will provide guidance and training. This is where this video or this recording of this presentation is going to live, and some other documents and tips and things like that. We're also going to be able to provide some outreach materials as well that can be used by any of our organizations, and also the reporting documents, and you'll get a much more in-depth training and information with your cohort. So we decided to do that with smaller groups, so it's a more hands-on experience, and so we will be looking out for a calendar invite from your cohort lead regarding that very soon. Some of the materials in that folder include some COVID-19 harm reduction information, COVID-19 vaccine scheduling information. That's more of a state level overview. I'm sure that there are many local opportunities and in your area that you are probably much more familiar with than I am. So the vaccine scheduling information is a broader scope. We also have some information on talking points, specifically about youth, either talking to youth or talking to parents of youth about safety. And we have materials available in English, Spanish, and Hmong. If you are in need of other languages or looking for other materials, outside of these related to COVID, please let your cohort lead know, and we will work together and get some of those materials that you're requesting or looking for specifically over to you. So we will make sure that we will work hard and quickly to make sure that we've got your needs covered. So just a review for the next steps, the MOU and financial report template will be sent out later this week. You'll also be getting a calendar invite from your cohort leader later this week as well. Also, I know that some folks have sent out doodle polls for scheduling that meeting, and that's where they'll go over the reporting, the outreach reporting that's due weekly. So that is an important meeting. So we want to make sure we can get as many folks to attend that as we can. The signed MOU and copy of agency's W-9 for those who will be accepting the funding are due February 11th, 2022 at 5:00 p.m. And then the first financial report that covers the November 1st of last year through January 31st of this year will be due February 28th by 5 p.m. So I have not been able to take a look at my chat, but I'm sure there are many questions. Teresa, do you have any questions that popped up in chat that you'd like addressed?
Well, Sheba's been doing an amazing job of addressing most of the questions. So thank you very much, Sheba, for your
awesome. Thank you so much,
that.
Sheba.
Yeah. I'm not seeing any that have not been answered by Sheba, to be quite honest. Just there was one again mentioning about, are we allowed to put on money or put on events with this money, to which Sheba did respond that yes, again, if those events support interactive research. And then again, just other questions regarding dissemination of the information. But yes, that's about it for now.
Awesome. I will open it up. So if folks who have been watching chat, maybe their question hasn't been answered, feel free to unmute yourself and ask away.
Give an example of what the community resources needed to recover from COVID-19 impact would be.
Sure. So potential could be the emergency rental assistance program. We have United Way of Northern California. We have flyers and information about that we can also share. There also may be community resources. If someone's in quarantine and needing food, there might be local assistance for food bags from food shelters and things like that.
Also, Darcy from the Peg Taylor Center is asking what data and documentation will be required regarding the contacts.
Yeah, so we don't need any personal information regarding the individuals. When you meet with your cohort lead, they'll go over the spreadsheet that will be the host for collecting the data. For our purposes, we don't need names or phone numbers or addresses of individuals. So we're just, kind of looking at, broader numbers. We had an event with, 25 people, something like that.
Okay, so you won't be needing statistical data like age, race, any of that stuff. Okay, Great. Good to know. Thank you.
And then Dr. Abel from RISE is also asking about previous months. So beyond just forward reporting, but also how to report previous months.
Yeah, so for this grant, we're looking between, no, sorry, my watch just started talking to me. So for this performance period, we're looking from November 1st through, until March 31st. And we will be providing a template for the financial report between November 1st and January 1st. And we'll also be sending out a template for previous outreach that can be submitted with that as well. So we can make sure that to collect all that data between November 1st and present.
We also have a question from Beth for Youth for Change, specifically about if COVID tests are purchased and provided with the funding, will the funding cover that cost?
I'm going to defer to Sheba.
Yes.
And does that also include N95 masks as well, Sheba?
Yes, so long as those are not for your organization, but for the community members that, or the contacts you're providing them for.
There's also been a question about if there has been already the requirements for engage or the amount of engagements already met previously. Are we encouraged to still collect more data?
Yeah, so we would encourage that. It doesn't mean you need to hold an event with 1,000 people, but we still, would love to be able to see, more information and education going out into our community regarding COVID-19 safety and things like that. We're still in a pandemic, and we still have, a lot of tools in our belt to help reduce illness and death in our community. So we would encourage to continue spreading the message.
And a follow-up question to that was, would there be more funding available to those that are able to continue the effort or not?
I am going to defer to someone else because I don't know the answer to that.
At this time, no, but come the end of March, we shall see. Additionally, I wanted to address, someone asked a question about reporting, what kind of information that you'll need to collect for reporting. There is some demographic data that you'll need to collect, and that, again, that will be covered in your cohort meeting. But I did want to mention that there will be some demographic data.
Thank you for catching that, Sheba.
There's also a question about when you're doing outreach efforts where you aren't going to necessarily be able to capture the exact amount of contacts you're coming into. Is there a way to estimate the amount of contacts that might benefit from what you're providing?
Sheba, would you like to take this one too?
Yes. So yes, if you could estimate, that would be all right as well. To the best of your ability. Obviously, it's beneficial to have exact numbers, but if you need to round up or round down, that's fine.
Awesome. Thank you so much. Any other questions? And I will add, if more questions pop up after this meeting, please feel free to email your cohort lead or wait until the cohort meeting later this week. So, and I'm sure those questions are gonna pop up after the call because I know I always have questions after they end. So please feel free to reach out to your cohort lead.
We do have questions rolling in through the chat, so I'm just going to keep replaying them as we go along. Yeah.
Okay.
Although, of course, encouraging people, feel free to unmute yourself and ask, but I'm also happy to replay them this way too. So just putting that out there. So again, I'm asking as far as, again, PSA announcements, website messages. There's been questions around that. And then, so as far as, does that count?
So are you gonna, okay.
Go ahead, Jiba.
Okay, the radio PSAs, any kind of one-way, so to speak, outreach, we do like to collect those numbers and there will be a reporting mechanism for that. However, those numbers that we attach to your funding are specific for the two-way engagement. So a two-way engagement, meaning you are having a conversation with somebody where there is some feedback from them. That is what we are calling an engagement, and how we are those are the numbers that we are needing. You're definitely welcome to use a portion of your funding to do the radio PSAs, but we still need those two-way engagement numbers to be reached.
With those two-way engagement numbers, would they be able to include, like, for instance, if you did a post on Facebook, somebody responded to that and then you responded to them, is that a two-way engagement?
I had this very same question actually when we first started this grant in 2020.
Yeah.
And it's like a very gray area.
Totally.
The only problem for that, and you'll see when you have your cohort meeting, is how to report that is in an event. Normally the social media stuff is captured as a one-way, so I don't think that they would accept that as an interaction.
Even if it's like where we're each having the conversation, like if it's a DM, is that different, or do you think it's all social media would all be a one-way?
Let's see.
It's just during the pandemic where we're interacting so much more that way. So
Sheba, I do remember seeing a spot to record if it was digital or not. Do you think that we could almost report under that?
Yeah, so they're under the activity type for the two-way engagement. There is an activity type that is event/meeting. I would argue that a DM, it could constitute a meeting.
Yeah.
And then you can also put that it was digital. So for that kind of instance, I would say yes. So if someone has a question on one of your posts, encourage them to DM you. That way you can kind of formally have that as a quote unquote meeting.
Gotcha. Okay, great. Thanks so much.
While we're on the topic of social media content, there is also a question about developing specific messaging for rural communities, and could the money be used to help develop that messaging?
I'm gonna have you take that one, Carrie.
Please correct me if I'm wrong, but I believe that, that is definitely a need that that needs to get filled. So I would say that yes, that would be an appropriate use of the funding. And I do have in the Google folder with the materials, there is a couple of rural toolkits, I believe in English and Spanish. I'll double check on that. So there could be some tools or some materials already created that could be beneficial, but I also definitely understand the importance of organically creating for your community, because our communities look different all around. So I totally understand that.
This is Lisa Toby. Thanks for that comment. One of the things that strikes me is Plumas County is we're #1 and COVID and how low we are with COVID vaccinations. So one of the things that strikes me that's been a barrier is we don't actually have local voices. So the folks who are unvaccinated will stay unvaccinated unless local voices that they identify with give them reason to be vaccinated. So if that's the focus, it would need that. I mean, the other part about one-on-one communication to give out masks or help with rental assistance is much easier to document that and much easier to do. But the underlying issue that would decrease the spread is really, how do you get people to move past not wanting to be vaccinated?
Yeah, thank you for sharing.
Tiffany, go ahead.
So one of the big things that we've been running into, we just had a vaccination clinic last Monday, is that in Southside, we have a huge homeless population that are basically made up of our community members. And we got them in the doors and they wanted to be vaccinated, but didn't have ID. Is this something that we might be able to, if I orchestrate getting them down to the DMV so they can get their identification card so they could actually get an ID to actually be vaccinated?
Sheba, would you like to speak on that one?
So that is a really great question. There is, so for one, I would need to look into the liability about that. When you're talking about, taking on that liability of putting people in cars and driving them somewhere. That said, travel is allowable, but let me check into the liability on that to see if that's viable. I'll have an answer to you by the time your cohort meeting is. It's a very good question.
There is a question regarding cohorts and agencies, and is there an expectation to coordinate or collaborate with one another, considering there might be some overlap in areas?
Yeah, thank you for that question. Really, these cohort meetings are, being able to break this group up so that you have a point person at United Way to be able to provide information and bounce ideas off of and to answer questions. I think that each cohort can determine what their cohort would like to be for them. I know that some of our cohort leads have a lot of folks within the same regional area. Teresa, I know she has a lot of Butte County organizations, whereas some others kind of have organizations in geographical distanced places. So Teresa's group might look a little bit different, and if they set expectations, they might be a little bit different than some of the other groups as well. So I don't think that we have an expectation necessarily regarding that piece of the cohort group, but that's something that can definitely be set individually in each group when you guys meet.
There's definitely also some questions about creative ways to utilize this funding. Specifically, let's say if there was a shortfall on rent paid by residents in transitional housing, would this be an eligible expense?
Sorry, Sheba, can you?
Yeah, wait, can you repeat that question?
Absolutely. So the question is specifically, would a shortfall on rent paid by residents of a transitional housing be an eligible expense? Because if there are multiple people living in a house and they were not able to pay this, they would be homeless otherwise. And
how would that be related to COVID?
I'm imagining as far as being able to stay in one space and again, living outdoors and being transient, I'm imagining, that's maybe the line of thinking. Yeah.
Okay. Okay. So rent is an allowable expense. I'm just I'm thinking through that concept. I will have to actually get back to you on that as well, Susan. That there are some very great questions coming up.
Yes, thank you everybody for all your questions. Let's see, we've got about 10 more minutes. So do we have a couple more questions?
The questions in the chat seem to be duplications of ones that have been covered, but again, opening it to the field if people want to join in.
There is one question. Would direct contact be limited to counties, specific counties, if the organization is working in a specific counties? Or can they expand?
I believe it would be in the service area that you cover. But if you have any questions about that, for example, if you have counties in Oregon, I don't think that would count. But if you have any specific questions regarding coverage, please email your cohort lead.
I'm asking that question because that question was asked directly to me. So I would want to know too. Like if they're going, okay. So is that a yes?
Sheba, you want to make sure I am answering this correctly, that it's for the organization's service area, unless it's outside of the state.
So they're wondering if they have it. Whoa.
So if they're
if
not
an organization does events in other, the tabling events, so they go into like a different county and they tabling like a powwow, and they do direct contact with people around COVID. Can they count that?
Yes, absolutely.
Okay. Thank you.
Thank you, Miriam. Okay, well, it looks like questions are slowing down, so I will just advance the slide. Whoops, that's the wrong way. So I know we've been talking about cohort leads a lot, and I just want to put on here our information yet again. So if you have any questions that pop up between now and your cohort meeting, please feel free to reach out to your lead, and we will answer all the questions that you may have. And we look forward to working with you. I'll stay on the line just a few minutes more, but if y'all have to, take off to 1 o'clock, please feel free. And thank you everybody for joining. And I'm really excited to be working with everybody.